She's had a BBL in the past and has since lost a lot of weight. And with that, lost a little bit of the volume, especially out here, that she liked. She's lost more on her right side here than her left, but there is a loss of volume in this area, loss of volume in this area. We're gonna put in AlloClae. We're gonna put in probably 5 syringes out on this side, 3 syringes here. We're gonna give her some time, see how it goes, and then we're gonna actually reevaluate to see if she needs more later on. Let's go ahead and mark her. We can see the depth starts here, so just kind of round out where it is here. I like to find the center of the depth here. You can see that it's gonna help bring up the lateral thigh here into the butt and just close up this area of indentation. On her left side, she has more volume. There's still some depth here that she doesn't like, but we are going to preferentially fill in this lateral butt. So she's had a BBL with the access point here. I don't like it because I can't really get to where I want to be. I feel that this is a better spot. One little access point here. And then I use this 18 French, 15 centimeter long blunt tip cannula. And this is great to tumesce. When I tumesce, I'll go in here, slowly go all around the area. I like to start relatively deep, start with a tumescent, every now and then a little bit of a pinch. This is the key to make her more comfortable later on. Nice and slow. She's had a BBL in the past, so she's a little more sensitive. Here's our AlloClae with the Tiger design cannula right on there. Incredible thought put into this actually, and one of the cool things is you see the markings on the syringe here, they extend down onto the bottom here, so you really get a good sense of how much you're putting in. I like to actually first start by just going in and actually getting a sense of the tissues. I will go in and just move things around a little bit, see how it is. Even if there's some tougher areas, you just get a sense. Now, she is really nice and numb now, and actually just by opening this up, things are moving around a little bit better. So now we can also grab our ultrasound probe and do some ultrasound as well. We can see our probe right there and just follow it to its terminus. I just switched my direction here. Okay, and so we've had some going in and we just continue. We've established with ultrasound the safe plane. And I do like to put in the product and then really disperse it in the area that I like when I'm working on these more broad territories. Again, I'm a big believer in fat equalization. After this, I think it's really helpful to prevent irregularities, to help the fat find the place that it wants to go. I do a little belt and suspenders here with the closure of the wound. I put a little stitch, put a little Band-Aid, and I put a little Tegaderm. We're done. We've filled in here. We've filled in here. You can see the fullness. Now this is always far from where it's going to be because there's a good bit of numbing medicine in there. You can see the white stuff here. And what's gonna happen now is she's gonna take it easy for a day or two. She'll be a little sore tomorrow, but she gets back up to her regular life very quickly and is going to exercise soon. She's gonna wear just some compression, some bike shorts for about 2 weeks, and she is good to go.